Good morning. Yes. Good morning. My name is Cristina Alexandru, and I am from the University of Edinburgh School of Informatics. I have been involved in the development of the Sirocco tool as part of the Sirocco project, and more recently, the Sirocco Exchange project. And I would like to briefly introduce to you the main functionality of the tool, especially the one which supports knowledge transfer in integrated care. And after me, my colleague, Tamara Alhambra Borras, will also present the evaluation, the results of the evaluation of the tool. So, as I already mentioned, the Sirocco tool was developed as part of the Sirocco EU project. It is based on the maturity model developed by the B3 Action Group on Integrated Care of the European Innovation Partnership on Active and Healthy Aging. I have provided the link to the tool. It is a public and free tool, so please feel free to access it and register, and you can use all of its functionality. The main aims of the tool are those of facilitating the scaling up of integrated care by first of all defining maturity to adopt integrated care through its use of the B3 maturity model. Then assessing the maturity of healthcare systems as well as the maturity requirements of good practices. And finally, supporting twinning and coaching, both to transfer good practices into new healthcare systems or to facilitate the improvement of healthcare systems. I'm going to focus on the assessment of maturity of healthcare systems and twinning and coaching for facilitating the improvement of healthcare systems in this presentation. But before delving into that, I'm just going to briefly explain that we have 12 dimensions as part of the maturity model that the Sirocco tool is using. Each of these 12 dimensions has been obtained through interviewing specialists across Europe, and it was validated through a Delphi study. Each of the dimensions has 6 rankings, from 0 to 5, as well as an associated narrative explaining the objectives of the dimensions. Starting with the functionality for assessing the maturity of healthcare systems, which is the most used functionality of our tool, we recommend going through the following process. So first of all, local organizers identifying local experts to be involved in the assessment, then the experts individually performing the assessment by using the Sirocco tool, sharing their individual assessment with the organizers, and the organizers setting up a workshop to discuss and reach consensus amongst the different experts as to the maturity of their healthcare system. Let's take each of the steps in turn. So in the first step, you can imagine that people with very different levels of expertise and experience can be involved. So for example, we could have a team composed of a doctor, an IT specialist, a nurse, and an administrator. Each of them would need to individually perform an individual assessment of the tool by using the Sirocco tool. An individual assessment of their healthcare system by using the Sirocco tool. And for this purpose, they can use the maturity assessment page. On the left-hand side of the page, we can see a form containing the 12 dimensions of the maturity model. For each dimension, we have rankings from 0 to 5, and users can move between the dimensions either by clicking the arrows or the question links from the top. As soon as they record the ranking, it will automatically also be represented in the spider diagram on the right-hand side, or they could directly use the spider diagram to record their rankings there. So we have the dimensions as the labels from the axis of the spider diagram. As soon as they have provided a ranking for a dimension, they must also justify it in the text area underneath. And finally, of course, click Save. As soon as the specialist has filled in an individual assessment, they will next need to share it. But you could imagine that because of their different expertises and experience, each of the specialists may end up with a very different assessment of their own healthcare system. To share their assessment, they can use the Share Assessment page and provide the email addresses of all of the colleagues they would like to share the assessment with. And then, during what we call the consensus meeting, the team would all get together and discuss each of the dimensions. So they can see comparatively all of their individual assessments, both on the form as well as onto the spider diagram by being represented in different colors. The legend helps because it shows what the different colors mean, and also by clicking on the labeled names with the different colors, one can open up the individual assessment in a different tab. So they can also look at the justification underneath each ranking given by each of the people, again by using the different colors. They would need to go through all of the dimensions one by one and discuss the ones where there wasn't consensus. So for example, if we have standardization and simplification, we see that people have disagreed on this, although two of them consider that there should be a ranking, the other two disagreed. So there would be a discussion and reading of the different justifications, and they may decide, for example, to go with the ranking proposed by the IT specialist. So they would record this onto that page, as they do for any assessment. And finally, going through all of the dimensions, they would end up with what we call the consensus assessment, represented as black to stand out comparatively to the other assessments. Okay, so this was the process for assessing the maturity of a healthcare system, but for good practices we go through a very similar process. The only difference being that this time we would need to look at the features of the good practice, the features of the healthcare system that the good practice needs in order for it to work. Going on to the next functionality, using the tool to facilitate knowledge transfer. Twinning and coaching is the process we use for knowledge transfer. So we have two ways of doing twinning and coaching in the Sirocco tool. The first one is between two healthcare systems, where one system learns from another more progressive system in order to improve its maturity in a particular dimension of integrated care. And the second type of twinning and coaching is between a healthcare system and a good practice, with the healthcare system learning what it needs to create in its local context in order to enable the adoption of the good practice. So this is for scaling up the good practice to this new context. I'm just going to focus on the first of these types of twinning and coaching processes. So experts who have previously assessed the maturity of their healthcare system, as we have just seen in my previous description, can use the Sirocco tool, first of all, to identify one dimension to mark as a priority for the improvement of their maturity, then to see other healthcare systems which scored higher on that priority dimension, and so they could learn from them, to invite those one candidate healthcare system for knowledge transfer, and finally, to have a discussion on the features that they would need to implement in order to improve that particular dimension, how feasible those changes are, and what adaptation would be needed in the local context. Let's take each of the steps in turn. To record the priority dimension for the improvement, the user would just need to go back into their consensus assessment that we've just seen. And here in this edit mode of the page, they can just go to any of the dimensions and tick the radio button underneath, which says mark the name of the dimension as your #1 priority. And this will automatically also label the dimension as a priority onto the spider diagram. Then, if they want to arrange for a twinning and coaching meeting regarding, for improving that priority dimension, the user can just go to the list of their healthcare system assessments, take the healthcare system that they are focusing on, and click on the twin button, which becomes active once they have a priority dimension. This will lead them to the page where they can see other healthcare systems that do better than them, that perform better than them on that one priority dimension. They can click on the link representing the name of each of those healthcare systems, which opens up a separate page with the comparison of their two assessments. Then, if they decide to go with one of those healthcare systems, they can return to the original tab and click Invite for Twinning and Coaching. And this will both show a confirmation on the page, as well as send an email address, both as a confirmation to the originator of this invitation, as well as to the organizer of the invited healthcare system, in order to invite him for a twinning and coaching meeting. As soon as this has been performed, the tool also records that there will be a future meeting within the Twinning and Coaching tab. So the user can access this tab either during that actual meeting or after it, and within the healthcare system to healthcare system column, they will find the association between the name of their healthcare system and that of the invited healthcare system, and open it up using the edit icon. This will take them again to the comparison of their two assessments, but additionally on this page, they can also, through discussion, decide on those features that the healthcare system will need to implement in order to improve on their priority dimension by learning from the invited healthcare system. So they can enter there the name of the feature, whether it's already partially implemented, how feasible it is, and what adaptation would be necessary in order to make it possible. And of course, save at the end. So this would record their decisions as to what they would need to do in order to improve on the particular priority dimension by learning from the invited healthcare system. The next step will be to capture action plans, which will reflect the rationale for twinning and coaching, inform about problems to be solved or informed by it, make recommendations or agree actions to be taken, inform decision makers about the priority actions that are necessary, and list lessons learned from the twinning and coaching. This wasn't part of the Sirocco project, however, it will be implemented as part of the knowledge management hub that we are developing during the Sirocco Exchange project. And I will pass over to my colleague Tamara.
So I'm going to explain the user's experience of using the Sirocco tool. So within the Sirocco project, we have tested the Sirocco tool in 5 European regions: Olomouc in the Czech Republic, Norrbotten in Sweden, in the Basque Country, in Puglia, Italy, and in Scotland. So in order to gather all this experience of the professionals using the tool, we organized different focus groups in each of these 5 regions. So the objective of this focus group was to capture the experience and the lessons learned as well on the Sirocco tool, on the different functionalities of the tool, for the self-assessment of the context, for the assessment of the good practices, and for the process of tuning and coaching. So we conducted different focus groups for each of these functionalities. I want to present all the lessons learned from this project about the use of the tool itself and the process of using it. The key findings and messages are that the Sirocco tool facilitates a constructive collaboration between different professionals, facilitates also the consensus building. So they meet to talk and discuss on a particular context, good practice, on a process of knowledge transfer. The Sirocco tool also enables dialogue, generates knowledge, and promotes reflection on the object of analysis, either if it's a good practice or a specific context. The Sirocco tool also provides support to make decisions or to present rationales to decision makers with regard to integrated care. In regarding to the future uses or wider implications of using the Sirocco tool, the attendees in the focus group highlighted that the Sirocco tool can be used in a great diversity of organization, also at different organizational levels and system levels, and with different stakeholders. Also, particularly, the Sirocco tool was found useful at high organizational level, for example, from a strategic perspective or with managers and decision makers. The Sirocco tool has been found potentially useful in terms of determining areas of policy making. In regard to our next steps, I would like you to invite you to our next workshop. Will be held now at 9 o'clock. I don't know which room, but I can tell you now. So we have granted with a continuation of the Sirocco project called the Sirocco Exchange, in which we are going further on the Sirocco tool. So we are developing a knowledge management hub, which will be helpful or try to facilitate the implementation of action plans in those regions that have moved forward in improving their integrated care. So thank you for your attention, and I let here our emails in case that you have any questions. You can always send us an email.
Thank you very much.
For their talks this morning. Has anyone got any questions? Got 5 minutes for any questions. Any observations or anybody doing similar things? What struck me was all three talks was about improvement, and the improvement in to someone's life. And although it was either research or tools or the concept of frailty and improving conditions for patients, at the end it's someone's life that we're trying to improve. Was it from the tool point of view, is it difficult to try and get people on board to use it?
No, not at all.
No.
We have people registering on the tool almost every day. It's very popular. Yeah.
And we are translating the tool in 5 or 6 different languages in order to involve different professionals that work at field level to use the tool. So, yeah. Great. Anything else? Well, I guess we have time for coffee before 9. Thank you so much for coming this morning, and thank you guys for sharing your work. Thank you.
It's
It's been great. Thank you very much.